Should every postmenopausal woman at least be offered some form of vaginal estrogen, specifically vaginal estradiol? Well, last week, my sister-in-law sent me a link to this article entitled New Research Shows Fewer People Are Using Hormone Therapy for Menopause Despite Its Proven Benefits. This article says that in 2023, around 1.8% of women in menopause are using hormone replacement therapy, or HRT, to treat their menopause symptoms. That's down from about 4.6% in 2007 and 2.5% between 2007 and 2014. Well, I'd suspect there may be a couple of other things going on here, like the fact that a lot of the women that I talk with get their hormone replacement from a compounding pharmacy, and not all of those prescriptions may be showing up in those surveys, which usually involve sort of combing through insurance payment records to figure out how many women actually use HRT. So in spite of that, I'm deeply concerned that so many women are probably being told by their own doctors that they shouldn't be taking hormone replacement therapy when they're perfectly good candidates for it. I'm Steve Goldring from simplehormones.com. I help hormone practitioners, but also patients, especially women in menopause, by creating easy-to-understand patient education resources. One of those resources is a digital course that I call the Menopause Solution. It helps women answer one simple question: should I take hormone replacement therapy for my menopause symptoms or not? Maybe you've struggled with confusion and hesitation, or maybe even fear around this exact question. If that's you, I can help you gain the clarity and confidence that you need to make your own HRT decision in just a couple of hours. But more on that later. Several of the menopause and hormone influencers that I follow have been talking a lot lately about vaginal estrogen and vaginal estradiol. My good friend Jill Shimolevsky is a nurse who runs an online community called Pausing Together. It's for women in perimenopause and in menopause. My friend, functional medicine expert Dr. Amy Killen, she's just up the hill from me in Park City, Utah. And Dr. Avram Blooming, who's a well-known author of a groundbreaking book called Estrogen Matters. All of these respected colleagues of mine have been saying, in one way or another, every woman in menopause should be offered some form of vaginal estradiol. Well, here are 4 scientifically based reasons why I agree 100% with that bold statement. Vaginal and urinary tract menopause symptoms are some of the most common and longest-lasting symptoms of menopause. When we talk about menopause, people tend to focus on things like hot flashes and night sweats, or maybe weight gain, even insomnia. But there is another set of symptoms that are often overlooked. Those are symptoms affecting your vaginal and urinary health. These symptoms fall under something called the genitourinary syndrome of menopause, GSM. They include vaginal dryness, vaginal itching, painful sexual intercourse, also known as dyspareunia, and recurrent urinary tract infections, urinary incontinence, urinary urgency. The thing about GSM is that it doesn't just affect a few women. It's incredibly common. Research shows that vaginal menopause symptoms affect, on the low end, 27% up to 84% of menopausal women. That means millions of women are dealing with these issues every day, often without realizing that menopause is really the root problem underneath them. Reason number 2, unlike hot flashes, vaginal and urinary menopause symptoms don't get better as time goes on. In fact, they usually get much worse. Hot flashes, night sweats, those often improve over time. Not always. I got a YouTube comment just this morning from a woman who said she's 72 and still experiencing hot flashes. But most women see those decrease over time. Vaginal and urinary symptoms like dryness, pain during sex, urinary urgency, those actually get worse the longer you're in menopause. Several studies highlight this progression of the genitourinary syndrome of menopause. A systematic review in the journal Climacteric reported that GSM symptoms such as vaginal dryness and urinary discomfort increase in both prevalence, how often they happen, and severity with time since menopause. Another study in the journal Menopause emphasized that these symptoms are unlikely to improve without treatment, and they're likely to continue to worsen over time. What makes GSM particularly tricky is that it's not going to go away on its own. Vaginal menopause symptoms are pretty persistent. One study even found that the longer a woman is postmenopausal, the more severe those symptoms can become. So if you're experiencing vaginal dryness or discomfort, it's not something that you can just wait out. Without treatment, it's pretty likely to stick around. Reason number 3 is that vaginal estradiol is very effective in treating these types of symptoms. Estradiol is available in several different dosage forms that are applied to the external or internal vaginal areas. There are commercially available FDA-approved estradiol products, including vaginal creams and gels, vaginal tablets, inserts. There's even a silicone ring that's embedded with estradiol that goes inside the vaginal cavity. Compounding pharmacies can also make other dosage forms like estradiol troches or suppositories. Side note, some women, quite a few actually, experience burning or itching or some type of irritation with a vaginal estradiol cream or other dosage form. That's almost always the fault of the cream base or some other inactive ingredient in that vaginal estradiol. It's almost never caused by the actual estradiol. That's why it's important to work with a provider who really understands these things and who knows how to get around those issues. A skilled and knowledgeable compounding pharmacist can also be very helpful in those situations. Systematic reviews and clinical trials showed that vaginal estradiol significantly improves symptoms like vaginal dryness, painful sexual intercourse, urinary urgency, and urinary incontinence. One review published in the journal Obstetrics and Gynecology found that low-dose vaginal estrogen products improved both vaginal and urinary symptoms while keeping serum estradiol levels well within the postmenopausal range. That means it's delivering results where those results are needed without raising overall hormone levels too much. Raising estradiol levels is a topic for another video, but in this case, you can rest assured that even if you're concerned about rising estradiol levels, vaginal estradiol is not going to really do that all that much. Which brings me to my 4th reason. Vaginal estradiol has been shown in study after study to be extremely safe, even for women with a history of breast cancer. One of the biggest concerns women have about using estrogen is the fear of breast cancer. In other videos, I talk about the fact that estradiol just has not been shown to increase the risk for breast cancer, period, in any dosage form. But the science is especially clear that low-dose vaginal estradiol is extremely safe, even for women who have had breast cancer. A study published in the journal Obstetrics and Gynecology in 2023 found no increased risk of breast cancer recurrence in women with a history of breast cancer using vaginal estrogen for GSM. Other studies like the Women's Health Initiative Observational Study and the Nurses' Health Study confirmed that there's no link between vaginal estrogen and major health risks like cardiovascular disease, stroke, or breast cancer. Despite the overwhelming evidence supporting its safety and effectiveness, many doctors are still hesitant to recommend vaginal estradiol. Why do you think that is? Well, the simple answer lies in the FDA's black box warning on all estrogen products. The FDA requires this warning on both systemic and local estrogen therapies, even though the research shows that vaginal estrogen is incredibly safe. In fact, the studies that led to the black box warning didn't even involve vaginally applied estrogen. Yet the FDA applies the same warning to these products, unnecessarily scaring both women and their doctors. My friend Jill Shemalevsky that I mentioned recently sent a message to her Pausing Together community that really hit home for me. Her message was pretty simple. She said, join the movement. Remove the FDA black box warning on vaginal estrogen products. She goes on to point out how over 50% of menopausal women experience GSM. We saw that it might be as high as 84%. But many of these women are too scared to use vaginal estrogen, even though it's very safe and very effective. The fear stems from that FDA black box warning applied to all estrogen products based on outdated claims from the Women's Health Initiative study from 2002. In 2016, the FDA approved another product, Intra-Rosa, which is vaginal DHEA. DHEA converts to estrogen locally in the vaginal tissues, but it doesn't have a black box warning. So why the double standard for vaginal estradiol? Millions of women are suffering unnecessarily because of this black box warning. It's time to remove that warning and clear up the confusion. You can join the movement by signing the petition at Unboxing Menopause. I have some instructions and a link to their page on my website at simplehormones.com/unboxing. Well, we've spent a lot of time today talking about how the FDA's black box warning and even some doctors have left women unnecessarily frightened of hormone replacement therapy, especially about vaginal estrogen, which is extremely safe. Well, it's no wonder that so many women feel confused or hesitant, even downright scared when they're faced with the decision of whether or not to use HRT. But here's the truth. You don't have to be afraid. The science is clear. Estradiol is incredibly safe and incredibly effective for treating several menopause symptoms. Vaginal estradiol, in particular, has been proven to be both safe and effective for treating the vaginal and urinary symptoms of menopause. We called it the GSM. When you have the right information about hormones and menopause, that's when you can make your own HRT decision with clarity and confidence instead of that fear. And that's exactly why I created my course, the Menopause Solution. If you've been struggling with whether hormone replacement therapy is right for your menopause or not, or if you felt unsure because of all the mixed messages you get out there, I can help you cut through all the noise. In just a couple of hours, you can have the tools you need to make your own informed decision, free of confusion and fear. The Menopause Solution isn't about telling you what to do. It's about empowering you with the right information to make the best choice for your health and long-term wellness. This course goes over all the systemic estradiol and progesterone treatments, as well as vaginal estrogen and DHEA therapies. It goes over testosterone and other hormonal treatments for menopause. After going through the easy-to-understand video lessons in the course, you'll walk away feeling confident, clear, and ready to make your own HRT decision. So if you're ready to replace hesitation with confidence and confusion with clarity, I'd invite you to check out the Menopause Solution. You can find out all the details on my website at simplehormones.com/decision. If this video has been helpful at all, click the like and subscribe buttons. And be sure to ding that little notify bell to get notified whenever I post a new video. Thanks so much for watching, and I'll look forward to talking to you again next time.